Good afternoon, this is Dr. Scott Pirochta from Healthy Life Dentistry. We have a lot of conversations in our office about health, obviously a lot of discussions about sleep apnea, about acid reflux, about diet and how they relate to the health of your teeth and gums. I ran across a wonderful article in the Spectrum Health Beat regarding gut health, and I wanted to share that with you. We have more bacteria in our body than we have our own human cells, and those bacteria are almost exclusively healthy, good bacteria. But when those bacteria, when the balance gets out of line and the bad bacteria take over, they're implicated in many diseases, including obesity, diabetes, autoimmune diseases, depression, cancers, heart disease, fibromyalgia, asthma, and more. Additionally, people with lower amounts of good bacteria also have a higher risk of increased fat tissue, insulin resistance, high cholesterol, and general inflammation when compared to people with a healthy gut. 70% of our immune system comes from the intestinal walls, believe it or not. And if something happens to damage the intestinal walls, such as infections, medications, food allergens, or toxins, the body's immune system is compromised and can lead to chronic disease. Our intestinal walls also contain more neurotransmitters than the brain. Lifestyle factors that can damage our microbiome are processed foods or a nutrient-poor diet, chronic stress, overuse of medications such as steroids, anti-inflammatories, antibiotics, and acid blockers. So what's a poor person to do? Well, we can replace our processed foods, sugars, refined carbs with fiber-rich whole foods. They suggest aiming for 75% of your plate to be plant-based foods, which is fruits, vegetables, nuts, and the like. Eat fermented foods that contain good amounts of probiotics such as miso, kimchi, sauerkraut, and tempeh. Forgive me if I mispronounced any of those. And then the other recommendation is to consider a 30-day elimination diet to pinpoint trigger foods. And I believe that is, for the people who I know who have done that, it's been very eye-opening, and I bet most people have food sensitivities that they're not even aware of. And not only does it make you feel tired, maybe not feel up to par, but also can be making you sick or be responsible for chronic disease. So please pay attention to your diet. There's an old computer saying garbage in, garbage out. If we're not putting the best of things in, how can we expect the best performance for our bodies? When I counsel my patients, I try hard to be realistic in our recommendations, and it's difficult to imagine total abstinence from maybe a not so good food or drink, but know their place, and if it's at all possible, limit those as much as possible to feel as good as you can feel or to have as healthy of teeth and gums as you can. It's just not realistic to go total abstinence, and it certainly isn't sustainable. So use your best judgment and surround yourself with good foods, and I would imagine that we would all feel better as a result. Once again, this is Dr. Scott Pirochta, wanting nothing more than to be a partner in your health care. I hope you have a wonderful day and stay tuned.